kinetic spiral line. It's a really important line because this is the functional line. We're always moving. We're always walking. Let's say I'm walk this way. My spiral line is working right now. If my one spine line is not working, how am I going to walk? I'm going to walk like this, right? You see, and I see all those old people walk like that. Why? Because there's no movements in the spiral line. We've been talking about this many, many times. We work on the front line, deep line, superficial line, posterior line, lateral line, and they all combine. But this line is the biggest one. It's the number one line you want to work about. So as you remember, the kinetic spiral line starts on your neck, right in here, occipital area. It's go cross under your rhomboids, go under your scapula, right in here, come on your ribs. So that's important to work on those ribs. Cross right in here on that hip, go around your leg, around that leg, and come into inside. After it's coming right here and go all the way up to your head and attach right here. So think about it. How loop is that? And when you see that postural, when you measure those hips, you see some people standing like this. You can see the shoulder is up and you think like, oh, the shoulder is up. So I just work on that shoulder, try to drop that shoulder. You drop a little bit shoulder, 2 days later, the guy has come back and he's still like that. Why? Because this is kinetic line, because he's sitting at work maybe like this. He's sitting, and maybe the second screen is right there, or he's working, look this way, or I don't know, maybe TV is there. So what's going to happen to him? The one kinetic line is become overstretched, another one line is going to become tighten up. And you try to get up, and the same postural, right? So ask people what they're doing during the day. He's a computer guy, or he's like working at the warehouse, or he's a massage therapist. So that's thing. Let's start work. David, are you going to be the model or Yana going to be the model? We've already been talking about this line many, many times. When you can start like any position, in face up, side position. What I want to do, I want to work on those, that kinetic line is right here. So many problems in this area, abdominal area. We measure when she's been standing. Now she's laid down. We're going to remeasure again. So what we're doing here, we find this anterior sacroiliac bone. And look at this. Can you come over here and see the left or right? Yeah, you're right. So you see that bone right here? So we're going to correct her. Let's see if we can do it. You see? This left is higher. So that's mean everything is tense up here. Is that correct? This one is kind of open this up, right? So we're going to open that one up. And what we're doing here, you want to measure it? So you guys measure hips before?
No, not this.
Okay, so we have, come over here from this side or that side, whatever. So what we're doing here, we find that anterior sacroiliac bone right in here. And what we're doing here, hold on, it's like that one, right in here, that big bump right in here. Right in here. So all you do is slide it down, you find that groove, and that's where you want to post your fingers up there. So go ahead, find it out like a bumps, you see, right in here. One, find the second one. Now slide your hands a little bit down under and find that groove. And see which finger is the right or left? This one, right?
Right is higher.
Yeah, so this is her left. It's your right, it's
right,
client left. Yeah. We always say which client side. So that's mean this hip is get tense, right? Also, I see on her chest how she's laid down. You see, this chest is really, like shoulder is really high. So what we're doing here, we already done this. But like I said, she's in dress. I usually place my hand just like that without any oil. And I ask my client, so I found that hip right in here, that iliacus muscles. And what I'm doing here, I'm just kind of back up a little bit and ask you to take a deep breath through the belly And when she's breathed out, I'm apply 2 pounds pressure. I always communicate with my client. If any problems, any pain, you let me know. I feel this pulsation. And keep breathing. So she's breathing. Doing okay? No pain? She's okay. And it's a lot of tension. So this is all... It's gone, yes. So what I'm doing here, I'm apply and I pull that fascia. So I pull that fascia up. Remember the cross? I can also kind of a little bit distract her, like she said, oh, something was in the beginning. I'm just shake her leg like this. She thinking I'm working on that leg, but I'm working on that. Front. And I feel there's a lot of stuff going on up here. You can feel it. So I'm gently, you see, I'm pulling this up. I don't want to pull down because we already in this position. We already slouch forward. The gravity always pulling us down. When we get older, we like those question mark. We always like that. So we want to pull that one. Do we want to touch this side? Probably not. But like I said, and just like that. And it's a superficial. Now I want to go deeper. You're going to be on next. 4 fingers I place right in here. This is the ilium. This is the navel. This is the middle, right in here. I'm going to apply the hands. Not perpendicular. Not any angle. Flat. Completely flat. She started breathing. It's getting hot in here, huh? Jesus, we need some AC. So I'm apply it. And she breathed. No rushing. Here we go. I find that it's very like a stone. How's it feel? Okay. She feels soreness, yes. But look, if I'm change the angle, what's going to happen next? Yes. Oh, it's ow, ow. Exactly. And I see people doing this ow, ow. So we don't need any ow, ow. Because this guy, if it's ow, ow, he's gonna what? Tense up, exactly. And hold this. She's not gonna be trust me anymore. She's in pain. She think I'm gonna do something bad. Like the lady comes up 2 days ago. A chiropractor adjusts her neck. She's so scared. She start touching gently. She thought I'm gonna adjust it. She just cry and say, please don't adjust me. I'm saying, I'm not a chiropractor. I'm not gonna adjust you. So it took me 2 days to prove myself I'm not gonna adjust her. So she started relaxing and the neck is get relaxed. So this is all I do, and I can go deeper and do deeper on the trust of the clients. And guess what? I can reach spine from here. Trust me. I can move that stuff around, all those deep 6 layers of abdominal area, and push that intestines a little bit on the side, because it's intestines here. You not do any damage if you do slow, any gentle, and relax. If you not sure, are you on that muscle or not, you ask your client, bring this leg up right there and down. And you feel that one? You feel this right away. Again,
So we can do stretch with the
Yeah, absolutely. Because this is side, remember, we can work side position too. Well, I'll show you. We've been showing this so many other times, but we continue show same over and over again. And you push this up to the rib cage. Also rib cage, a lot of muscles like oblique muscles or rectus abdominals attached to those top ribs. What we're doing here, we find the ribs. We slide our finger under that rib very gently. You see, no oil. No oil, David. You see, she's a little bit spasmed. That's fine. I'm just going to...
No, just because I was smiling.
Oh, okay. And you do that. So you work on that groove. Next one, what I want to do, I want to pull a little bit. So what I'm coming up here, I want to get that little bit action. The one arm is coming under the Achilles tendon. I lock it in, and not actually this one. I like that one. So whatever you feel comfortable. Left on the bottom, right on the top. I'm not adjusting. I'm just pulling towards me. Or you can even do grab. If this is a small foot, why not? It's not like a 12 inches that big basketball player guy with 13 inches. And you see what I'm doing? I'm distracting that hip and I'm pulling. Open this up. I ask you to breathe. Now I'm asking you to pull that hip up, hip hike. You see what she's doing? She's hip hiking that hip. She's moving that hip. Yeah, pull up. And let it go. Relax. And I pull more. I get that. Distractions. We are ready. And look at that hips, how they moving up there. And release. Okay? Now I can remeasure what I'm done. Did I did anything? So I come back to this interior PSOS, and it's almost the same level. The problem is she's get up, she's going to go do her thing, she's going to drive her car, whatever pedal, whatever how she's walking, and it's come back. What I need to do, I need to give her exercise to do that. So now Daniela is going to do that. So, I'm going to go see what's going on with this. Go ahead.
So we start with that movement so far.
Yeah. With the breath. With the breath.
Okay.
With the breath. Don't be scared.
Okay.
Everything.
It's not that deep.
Yeah, not deep. That's it. That's it. Pull. So it's kind of sliding. The fascia, so watch. If you guys look, keep going. You kind of, So how to check the fascia, where's the fascia stuck? You apply your hands to that, let's say, area. And what I'm doing here, I move that slide, that kind of skin, you will feel it. It's coming up, it's coming down, it's not going to this way, slide that way. So I don't feel that fascia is going that way. It's kind of like stuck up here. So what I'm going to do, I'm going to work in this area. I'm going to release that fascia without any oil. So you have to feel that friction. How's it feel?
Okay.
Good. Always talk to your client, like how's the pressure, how you feel, what are you doing, how you doing.
Do we change the angle then, or we just?
You can, you can work around. It's basically like a belly massage, but yeah. Yeah, we already show many times. I can show different variation, like diagonally 45. You want to do 45 degrees. Remember, this line is coming this way, so you just follow the line. She's dressed, but I will probably like work all the way, like, that line. Because remember, we have the rib. So let's think about it together. If this one is higher, which rib we should work? We should work on that side rib area, the breathing, or on that side rib? If she's like this. So this is higher. Which side rib we're going to work?
Well, you have to look on the right side, I think. I think we should look at them both, but the right get crunched.
Exactly. The simple answer, we're gonna do both. But yeah.
The right gets crunched.
But if she's hip is high, that's gonna be the side is gonna be really tense. Good. And go ahead, try to do this leg distraction. No, I mean, that's fine. I mean, go ahead, grab the leg. Yeah. Grab the leg and feel that pull. Always. Yeah. Whatever. Here we go.
How does it feel?
Yeah. You see, whatever you see, if start moving, it's good. So distract it and ask her to start, hip hike. You
And that one, you resist that move? Or
you resist, exactly. You resist. You kind of hold it, only hold it. Good question. So you just hold it. She's pulling up. She's activate all these muscles. Also
like
good.
Kind of like resist her. But
Yeah.
then I'm start to pull it.
Exactly. And when she relaxes, let it go. You always count to 5. You can do count to 5. You can guide your clients. So you pull, yes. 1, yeah,
3, 4,
and relax.
5.
Yeah, relax. Exactly. Boom. Look at that. So when you always have to. And I do like a 3-4 times.
1, 2, 3, 4, 5. Relax.
Perfect. You see, you pull her, yeah, and that's a good stuff. Good stuff. And you can remeasure, come back and see what you did. And sometimes, look, this one is already lower. That's okay. It's good. No, that's good because she's come back and it's take her another day, extra day to get that hip where it's supposed to be. I always pay attention how people lay down, how the leg is. That
Usually mean that the glute muscles are over.
It's gluteus medius, correct? Yes, gluteus medius is out, and it's also hip problem. Some hip is over. Get that internal rotation of the hip, and external rotation of the hip is limited. So
Like this leg now is straight up, and this one is
perfect. Yeah, this is good. This one is a little bit rotated. So we usually give them the bands. They work with the bands, and it's kind of get that leg like this. But sometimes, yeah, you can see this. People come like this, all the way away. Like what's that? Not the supination. It's not eversion. It's like external rotation. Yeah, of the hip. Okay, next one. So we remember that kinetic line. We can work on the neck here. She's a lot of chain. I can work on that neck. Remember this, my favorite exercise. If you see the neck like this, it's like tilted. So this kinetic line, it's pull her this way. So what I want to do, I want to open this up. And for her, I believe that's going to be the side, right? Because when she's laid down, she's already like turned his head. She liked to turn this way. You always pay attention. You never tell the people what's going on. You pay attention. Boom, there. Okay, neck is there. So I come in up here. This is my favorite one. No, that's fine. So you lock the head in. You don't push too hard. You not try to crack the nuts up here, people push so hard. Very gently, whatever your arm is, you cover the forehead. You come up. So if you work on that side, so we work on the left side. Left arm, coming with my right. I'm wrong because I have to come to the opposite side. I want that arm go all around this. And I come around and I grab that. Now I ask her to turn to the left. And what I'm doing, I'm lift that head up and pull my arm. You see my arm is straight. For the camera, I have to show you this way. And it's a lot of chains up here. So we usually ask people to remove your necklace, all those chain, because you're going to scratch the skin and could be do damage to the chain, and you will pay the money for it, especially if it's diamond and gold. So, but anyway, right in here, all the way around. You see my fingers right there? You see them? David, you see my fingers?
Yeah.
All right, perfect. Lock it in. I ask you to turn to that left side, and I lift that head slowly and pull my arm out. Yeah, definitely we need to remove that chain. At least 1%. Sure. He's been done this many times. Come over here. Okay. So what are you doing here? Let's say work. Yeah. Okay. Come up. Remember the arm is straight. This arm is whatever you head. Gently. This one is go around all the way. You can lift the head first if you want. Watch. Here we go. Now this is straight. And ask you to turn to the same side of your arm. And now start pulling your arm out. Like pull. Slow pull. Lift her up and pull. There we go. Slowly and relax. How's it feel, Yana? It's good? Yeah. So Let me just show you again so you're going to see it. Right in here, fingers, gently, and all you do, lift, and she start turning, turn. You see, she's activate that muscle, and you start pulling. Она активирует, и ты ее вытягиваешь, и ты чувствуешь ее.
But we first you ask her to rotate the
Rotate
to the
head,
opposite
yes,
side.
exactly. To the same side of your arm. So where's the arm? She rotate to the same. If she's going to rotate it, you're going to just slide off. But if she rotate towards your arm, you're going to feel this muscle activation. Try to do opposite side because we want that. There we go. Feel that? She's active. Ask her to rotate. Ask her to rotate. Head. Feel that now? Feel that muscle?
You're going to turn to the right.
To the right.
Your left side. So you're going to turn this way.
Mm-hmm.
But I was turning that way.
Oh,
Exactly. Good.
oh, okay.
Do you feel that muscle activation? Ты чувствовал мышцы, как напрягаются? Ага. She turn. Very gently. There we go. Something like that. Yeah. It's practice. Plus, it's a lot of practice. Okay, next one. It's not connected to it's related to our kinetic line. I always pay attention where's that shoulder is. You see the distance from that acromial to the table, and look at this one. You guys see the difference?
It's not uneven.
Which one is the higher?
Right is the higher.
Exactly. Right is the higher. So that's mean when she's laid down, she rotated to this way. Remember when David did this test on David? I'll show you guys. So this is like kind of weird stuff, but this is called a rolling test. Let it go. Relax your arm. You covered. Can you grab the sheets for her? We're just gonna cover her in this case. So what I'm looking for here, I'm just gonna cover you here. So there we go. All right. In this case, what I'm looking for, I'm see how person roll to the left and to the right. When I roll to the left, I step this to the left, but we test the right side. And what I'm doing, I'm gently pull her out and see how I can roll her. Can I roll her this way? It's very restricted this way. Now step to the left, try to relax, don't try to do anything. And look how easy I can roll her this way. I usually, like before, if you watch our first class, I ask to people do this on the floor, how they can rotate without kicking, without using the legs. And we see this shoulder is higher. So she's like that. What we want to do, we want to put that shoulder down. Okay? This is part of the treatment, but we kind of skip that. So what we did, we work on the abdominal area, we pull that hip down, we work on that neck. It's time to work on our between our shoulder blades. Usually I do the sitting position, but let's flip. All right. Yeah, it's not like so much to show up here.
Do you have a paper?
Yeah, it's actually a clean one. I just clean it. Oh, maybe not this one. There we go. So here, when people lay down, face down, what I'm doing here, I get that foot, kind of shake her up a little bit, pointing a little bit out and pointing this foot inside. Now I can measure this hip. In this case, what we're looking for that posterior sacroiliac bone, which is right in here, right? This one right in here. So, and I'm see how it's in that prone position for her. I'm coming from my dominant side, which is left. My left dominant eye. If you guys don't remember how check your dominant eye and not, watch our previous video because it's going to be too much stuff going on. So, what I'm find it posterior sacroiliac bone, and I see how they are is. So I feel this one is deeper, this one is higher. So that ilium, it could be this one, is could be that pull that way. So because this one is higher and this one is deeper, could be deep. Okay? Twisted, correct. Also, what I'm looking for here, I'm go all over that spine and see how that spine look like. It's supposed to be no bra up here, but like I said, we just go the idea what to do. Well, idea what to do and just practice. So this one, I come up on that SI joint, kind of sacrum, ilium, right here, lock it in. Already we've done this many times. Come on with my flat arm, no hug, like no hawk. Come up here gently, start pulling my client. You see my arms is straight, my back is straight. I show you if this is big person. If this is big person, you get this arm away, you come up with both hands, lift it up, use your knee. You see, I put my knee and I bring it up. My hands is straight. Ask this client to push down, push down. 1, 2, 3, 4, 5, and relax. But if not, lock it in, get that ilium, push to the side, feel that first restrictions. Yes, first restrictions. And when I'm ready, ask her to push down. She gently push down. I always tell people 20% of push. 1, 2, 3, 4, 5, 5. Relax and get to the next level and kind of a little bit like it's called like a jostling rocking. Again, one more time. 1, 2, 3, 4, 5. Of course, I'm calculate slowly and let it go. Look at that. Now this one is lower. But that's okay, like I said. What here? Here, what else I can do? I can work on those kinetic, like remember, it's come from here, go right on the scapula and go around that belly. So you want to do this twist. Come over here. So you're basically looking for to grab that gently, not the hook, gently like this on that hip. SI joint. Lock it in and lift her up. Straight arms, perfect. Straight back. There we go. First restrictions. Boom.
And then what you
Yeah.
have to
Ask her to resist and push down.
please push down for me.
Say, I always say, now,
Count to 5.
exactly, count to 5.
1, 2, 3, 4.
And she's relaxed and tell her relax. And you pull a little bit more.
Oh,
There we go. So she always restricted. Yeah. You feel that first barrier. So граница, ты не можешь больше делать, не надо. Вот оно все, вот ты почувствовал, что она затормозила. И все, и ты просто стоишь на этом, она начинает дышать и сопротивляться тебе, против тебя. То есть она активирует все эти мышцы, активирует кинетическую линию. И ты как это, балансируешь hips, тазобедренный сустав. И отпускай. И теперь смотри. И потом remeasure. No bolster under the foot, and the foot it have to pointing inside each other. If this is going to be like this, you might be not accurate the assessment. Okay, and you can see I can see already from here, it's already like dropped down on that side, right? David, you want to take a look? There we go.
Yeah, that's a little too lower.
This is important. I'm going to stay on opposite side. So I usually stay on that side, but for you guys, for the camera, remember, what people like to do, they always like to grab that scapula and stretch that scapula away. They try to pull that scapula. This is not what we're doing here. We want that pull it back. Sometimes it's a door dish. Remember when the back is flat? Actually, she might have a little bit right in here. Yeah, you see it's kind of like a little bit more in. It's not rounded. But what we're doing here, we grab that erector muscle like a longissimus or semispinalis, find that bulky stuff, and what I'm doing here, this is laminum groove. I'm never push on the spine. So idea is we not push on that spinal process. We go to the laminum groove and start pushing on that one. Okay, away from the body and not so far. Just a little bit. So I open that space. And this is all I do. This is the motion. This is the motion. Working on those small muscle like a multidae. What's the rotaris? Yeah, all those muscles. Remember, this muscles is like a pine tree. They'll go one to the next vertebra and another one from the one vertebra. So it's kind of like a not a railroad.
Intertwined.
Yeah, exactly. Thank you, David. My English is not good. Sorry, I'm from Mexico. And it just push outside a little bit. And of course, you both work both sides, and that's idea. Next one, what I want to do, I want to get that muscle active. So I pull all these different directions. What I'm doing here, I work with the fascia. I'm not poking people. I see people doing this. They're poking them. I pull the fascia. You see, I grab. This is the bra, but I usually pull the fascia. I pull the fascia in all different directions to see where's that jammed. Where's that jammed? You can use your knuckles. This is even better. Just like that. And I'm definitely not doing this. Like people inhale, exhale, and you pull down. Because she's not rounded. She's not so round. A lot of people lay down, they're round. They have that hump. She don't have a hump. She's already kind of good. If you push more down, what's going to happen? You're going to push those spine more inside. That ribs is going to be pops here on the side. You're going to see that big, like a, yeah, what's the call? In Russian, it's a tranchea, like, it's pull inside, English. Like a cable line, like a cable line. And when people try to dig the cable line, you can see that big line, and you want to pull away. So pull that cable out, not in. That's what the idea. So all different directions. Like I said, she's in the bra, but I'm usually grab that fascia, pull. You see what I'm doing here? I pull towards, move around, stay from this side, pull this way. And what I'm doing here, yes, pull, reactivate. And that's the key. Like I said, so many variations. Sitting, it's better. I like to work sitting when people are doing that sliding, hands up and down the leg. This is the one. Okay, what else we can do? David, what else we can do here? We can...
On the line, did you finish all up?
No, I didn't finish line. The line is so big. What we can do here, we can work on that, on the whole line here. Remember, if you work from the head, you work down to the butt. Because what's happened here, if we lean forward constantly, this line is overstretched. So we want to get this direction. So we always find that spine, place on that, the laminum groove. I don't push too hard down. I don't want to push this down. What I'm doing here, I'm slide this direction. So you can use this way. You see, my back is straight, my leg is straight, and I'm pulling down. So I'm leaning with my body. You see, when I push her, the whole body is moving. If I put too much oil, what's going to happen? I'm going to slide. I'm going to slide away from her. I mean, down. And sometimes I see people like they kind of standing in both legs, like, and what's happened to them? They slide off and they follow down right on the customer, right in the butt. Boom. So I saw that happen in the school, of course. But you want to hook that fascia. You see, when you move the person like legs is moving, you hook that fascia. And it's no oil. You gently pull it down. You see? Don't push on the ribs. You want to try it? So what we did, yes, find that spine, so spinal process. Find that little bulky stuff. You can feel it. Come over here. You feel that like a bulky stuff like there? Yeah, so you want to grab that before and start pulling outside. Yeah, like your fingers. Like this. Like grab and you pull out. See, bend and pull out. You can do straight if you want. So you pull and let it go. Okay? Yeah. Don't worry. Get that. With the practice, it's everything common in practice. When you start doing your massage, when you first year in the massage industry, yeah, your fingers get a little bit kind of not used to it. So after a couple years, they get stronger fingers, and you're gonna show more effective stuff. Yeah, even the big guys, with the strong hands, they still kind of, I don't know how I'm gonna say that. Here we go. Yeah, stuff like that. There we go. Good. How's it feel, Yana? Good. That's good. And remember, it's go around our foot, go here and all the way up. So this is what we're doing. We don't forget to work on the sternocleidomastoid. We're supposed to work on the sternocleidomastoid when she was face upward. We already did this last time. What we want to do, we want to work on that foot. And remember that foot, what we did last time? If this fascia is coming around that foot, what we're going to do? We're going to grab that fascia and start pull this direction, because most people is walk like this, the foot, leg inside. So if the leg inside, this one is overstretched, this one is tighter. So that's why we want to pull that ankle. We can do this way, we can grab and do both. Like you see, my arm is covered that foot, this one, and on our Achilles. And what you're doing, you slide down and work on those calf muscle, the gastrix. Actually, you work a little bit on peroneus too, right? Rotate it. See this move? That's the move. Don't do too much, because if you do too much, you can do some damage. So it's very light, 2-3 pounds, that rotation power. Okay, you can also work here standing. Remember we did this one. When you come up here, lean on that. Remember, David, this one? And we work on that behind the knee. Also, you can, from this position, you can open that foot. And if this person not stable, if you ask him to stand in one leg, if this is wobbling, what we're going to do? We're going to stabilize, not immobilize. Okay. She's pretty good up here. I don't see any problems. Here we go. Try that chicken dance. It's called chicken dance.
So then the same time rotation on both arms?
And away from your body. Let me show you one more time. Watch. You see, you go like this. You see this the big thumb under. And also you can apply. You see this one is scooped kind of down. So you're doing this. So the fascia bag. There's a lot of fascia bag in our calf muscle. That stiffness, like pain in the calf. There we go. So this is great massage therapy for clients to release that. Say it again. Tell them.
Too much?
Too much? Okay, too much is good. I'm just kidding. Yeah, okay. I'm going to hold your hands.
Oh, I see. It's very light.
Yeah. And you can just like pull more. You see? Yeah, good. That's the thing. David, you probably know everything. Okay. I'm going to... Good. Yeah, side position, side. We already been worked so much side. Abdominal, sitting. Yeah, let's do sitting. But you're gonna sit towards the R sign, okay? Thank you. Just take your time. Don't rush yourself. Yeah, don't get up so fast. Here, this is too high for me. I'm probably gonna find something like my bench with this camera is. What I'm doing here, I work on those breathing muscles on the side position when she's laid down and she's extend her head over. You can also do, if you record me from this phone, sorry, I'm going to put my butt on the camera so you're going to see that beautiful view now. So what I'm doing here, I'm working on that muscles right in here, and I remember I want to pull this towards the spine. So it's a bra right now. I usually ask the people, like, I show you that. Let me just get that. How I do this with the female clients. If the male, it's no problem, but female, I usually get this around her shoulders, and she put this on the armpit, like this. This one is too. Hold on. Yeah, here we go. And on the armpit, and I tuck right under the butt. So she's supported. She feels safe. Now, what I'm doing here, if I'm standing right here, it's going to be too much pressure for me and I can injure myself. So I step so close, and what I'm doing here, I grab those muscle and I start pulling them towards the body, just like that. You okay? And I gliding because the bra up here, but I hook that and I pull towards. If I want more, I lean kind of. And like I said, it's so many variation. If you guys learn all those techniques, you can work thoracic mobility. You can work rotation of the spine, everything. From here, you can do everything you want. Look, she can place the hands behind the head. You can work on her spine this way. You can, this elbow, she bring inside, and that's it. She's all yours. Watch, I can completely control her. One hand. And I can work on that spine right now. See, I can pull this way. I can mobilize it. I can pull to the side. I can rotate her all different directions. You see what I'm doing? Oh, there we go. You feel that pop? She just popped right in here. Pop. You want to do more? Get this arm like this. If it's heavy person, you place it up here. She lay down with her head. You step right here. It's coming on your chest. Side bending, rotation, all that stuff, okay? I'm not showing that because this is not part of the class. I just get you idea. Okay. This is I mean, it's so much variation. Like I said, you can work on the sternocleidomastoid seating, lay down. You can work that. We already work lateral line. So the supraspinal line can combine with it. Front line, deep posterior line, anterior line, and also lateral line. So if you guys work on those lines, going to be beneficial for the clients.